Hi there, my name is Kim Norman. I'm currently an Indiana State University nursing student, and I will be giving a presentation focusing on breast cancer titled Detection is Prevention, targeting the population at risk of Latinas who are in reproductive ages between 12 and 48 years old, educating them on breast cancer prevention via the following learning objectives. The learning objectives. At the end of this presentation, you will be able to state why it is important to regularly perform self breast examination. You will be able to describe and demonstrate the steps of a self breast exam. You will be able to state the best time to perform a self breast exam. You will be able to detect and describe any changes within the breast tissue. You will be able to state when you should seek medical attention. At this point, we'll now dedicate some time to completing the pretest. So, what is breast cancer and why is self breast examination so important? Breast cancer occurs when cells within the breast begin to change and multiply, creating tumors that can be felt as lumps. Tumors can be benign or non life threatening or malignant, life threatening. Many lumps or bumps felt within the tissue are normal. That is why every woman should be aware of how her breasts feel normally in order to be able to detect any changes. The American Cancer Society recommends that women between the ages of 40 to 45 years old start screening with mammograms, and women 45 years of age and older should complete routine yearly mammograms. It should be noted that mammograms do not detect all breast cancers. Therefore, all women, regardless of age, should know how to perform a self breast exam, as this could save your lives by detecting life threatening tumors early. According to the National Breast Cancer Foundation, 40% of breast cancers are detected by women who feel a lump. That is the main focus of this presentation as to why self breast examination is so important. Now we will go over some statistics concerning the Latina population. According to the American Cancer Society and the Susan G. Komen Foundation, breast cancer is the most common cancer diagnosed in Latinas. It is also the leading cause of death. Latinas are less likely than non Hispanic white women to get appropriate and timely breast cancer care. They also have lower rates of breast cancer screens as compared to that of African American and Caucasian women. Latinas tend to be diagnosed with more advanced breast cancers than white women. This is due to many factors, such as lower mammography rates, delays in follow up after abnormal mammogram results, not having any health insurance, low income, lack of access to care, lack of a primary care physician, lack of child care, lack of sick leave, fear of bad news or that the procedure will be painful, more recent immigration status, cultural and language differences. According to the Pan American Health Organization, in Latin America, breast cancer ranks as the first cancer type among women, both regarding new cases and deaths. Latin America also has a greater proportion of breast cancer deaths occurring within women under 65 years of age, or 56%, as compared to North America, which is 37%. Several Latin American countries have some of the highest rate for risk of dying from breast cancer, highlighting the inequities in health of the region. How to perform a self-breast exam. First, visually inspect your breasts in front of a mirror with your arms at your side, your hips, and then raised. The different positioning will change the way the skin of the breast tissue pulls and allow for any lumps to be more visible. In the shower, place your unused arm and hand on the top of your head. Then, using the pads of the first 3 fingers, move around your entire breast in a circular overlapping pattern from the outside in towards the center, palpating the entire breast and underarm area. Remember to begin with light pressure, then medium, and then deep. Repeat this for both breasts. If lying down, raise the arm of the breast that you are examining and use the pads of the first 3 fingers of the opposite hand and continue with the same process as when in the shower. Also remember to squeeze the nipples and check for any discharge other than breast milk. Limitations and risks of self-breast examination. Fear or anxiety of bad news or a painful procedure. The risk that further testing may be needed. A self-breast exam does not take the place of an examination by a doctor. It is a supplement to it. What is normal breast tissue? And when do you know when to call your medical provider? Most women's breasts are lumpy. If the lumpiness feels the same throughout and feels like your other breast, then it's probably normal breast tissue. When you do need to call your doctor is if you discover any new lump or bump, which can be either painful or painless within the breast or underarm area. If you notice any swelling, warmth, redness of any part of the breast. If you notice any breast or nipple pain that does not go away. If you notice any nipple retraction or turning inward of the nipples. If you know any itchiness, scaliness, rash, or thickening of the breast or nipple that looks like the skin of an orange peel. And if you notice any nipple discharge other than breast milk. Importance of regular checkups. Due to the various symptoms that can occur, a medical provider can complete other screening tests such as mammograms, ultrasounds, and MRIs for early detection. It is important to note that not all new lumps or bumps mean that there's cancer involved. These symptoms can be caused by something other than breast cancer. That is why seeing a medical professional is important. Your body is like a car and needs regular maintenance even when things are working smoothly. Remember that the sooner detection is made, the better the outcome will be.